back to No Filter Needed, episode 3.
This week's episode is going to be spicy and unfiltered stories. So we're going to talk about like unhinged patients, bad behavior, aesthetic fails, or trends that we think are just outrageous. And yeah, that's about it.
I can start with one story, which is
Okay.
kind of funny. I mean, it's not an unhinged story, but I had a patient that was roomed waiting for me to do Botox and lip filler.
She was like already in the room.
She was already in the room, prepared, numbed, and everything. I'm coming into the room, and it reeks at a weed
Oh my god!
smell.
Wait, did she smoke?
I
in the
don't
room?
know. I have no idea. But I can just say that at one point I didn't know if it's starting to affect me. So I would say it's not. I can say it's a no to smoke before.
Yeah.
But if you want your injector to be with it while injecting you, I would recommend not smoking in the room or having any fumes of that coming at me before I'm injecting.
No, you're gonna get like second hand high.
Yeah, that was not a good thing, but
I would not know
somehow
how to
survived it.
function. Like, I feel like if I was high, I wouldn't even know how to talk.
Yeah, I survived it somehow, but that was a little difficult.
I think one of my most unhinged stories was, well, first off, we had a patient and she came in with her daughter. Her daughter was like 5 years old, just like sitting in the lobby like this, full on goes and pees in the corner of our lobby, like on the carpet, like just sits down and squats like a dog, and is just peeing in her lobby with patients there.
Oh my god, people train your kids.
And she didn't say anything, so I'm here cleaning up piss in the lobby of a med spa, and the kid's just staring at me.
Oh
like,
my
I've never
God.
seen anything like that in my life.
Wow.
Yeah. Also, too, I had this one guy coming in for Morpheus treatments, and he was treating his full face and neck. And every time he would come in, like when he came in for the first initial consultation, he was such a cool guy. Like, we were talking, it was like great. He knew exactly what he needed to get done for the treatment plan. And then he comes in for his first treatment. It was, I mean, men are babies when it comes to treatment anyways, but he was like, ow, like this is so painful. Then he comes in the next time and you can tell he's like high off a kite, like on something.
Oh God.
So I'm like, are you on anything? Because certain drugs, like you can do drugs and whatever you need to get off of pain, but some of them are photosensitive. So I need to know like what you're on.
Yeah, and a lot of people
like,
wouldn't
no, I'm not on anything. I'm like, oh my God.
say.
So then finally after the treatment, I mean, he's totally fine at this point. He was like, yeah, I took like 2.5 Xans before I came in. I'm like, okay.
It actually is very important for patients to disclose all medications.
Yes.
Because this is a no judgment zone. The only reason why we're
like, I'm not
asking
gonna
is
go like call the cops on you, I promise.
Yeah, it's for your own safety. It's for the patient's safety, because some medication can be contraindicated to what we're doing, what we're injecting, what we're So it's very important. Always disclose all medication, whatever drug was taken, and don't worry about the repercussion. The only thing is that we're worried about is your safety.
At the end of the day, these are aesthetic treatments and people look at it as a luxury, but they are still medical treatments and they affect your body. So we have to know exactly what you are taking or doing with your life. And I know we've all been in that situation. I've lied to my doctors when I was young about everything. I didn't smoke, I didn't drink, I wasn't having sex. So it's okay. We won't judge you. I had to clean up the pee. Yeah. And the worst part about it is the way our spa was set up is it's the lobby and the bathroom's right here. Like, just go into the bathroom. Why did you have to pee on the floor? What is the craziest botched work you've seen on a patient coming in that you had to fix?
I feel like I've seen so many at this point.
Yeah, I know.
I feel like one really bad botch that I remember seeing is a patient coming to me with a complete raised eyebrow. I almost feel like it looked like, I don't know if you remember that Adam Sandler movie when he has that one patient with the one that was kind of similar to that, and I felt so bad for the
Wait,
patient.
what's the witch or the like villain in Despicable Me? What's that is it that cartoon where their eyebrows like all the way up like this, or is it The Incredibles?
That's a good question. I wouldn't have.
I don't know.
I would not,
or maybe wait.
No, that's the guy.
I'm thinking of the Phineas and Ferb scientist.
Who?
Dr. Doofenshmirtz.
Oh,
Dr. Doofenshmirtz.
No, it's the one picture I keep on seeing coming up when people refer to the spook brows is the one from Star Wars. I forgot what it's called, but when he has this
Star
like
Wars.
super.
I've only been on
pointy.
the Star Wars ride at Universal or Disney. I've never watched it.
Anyways, one of her eyebrows was up to here almost, and then the other one was drooping by a lot.
Was she like freaking out?
She was freaking out. It wasn't done by us. It was done by a different spa, and she didn't even want to go back there. She was just freaked out. So I kind of had to do it at a stage-wise approach with her because I didn't want to overtreat and then create more problems. So what I did is I just added a little bit more units to the top of the one that was spooking.
Super raised.
And then I gave her a little bit of bra lift on the one that was dropping.
To like kind of even them out.
So then she came back after a couple of weeks. It balanced out pretty good, but we still needed to treat a little bit. So we just added a couple more units to the same area. And then after 2 weeks, she was fine.
That's wild.
But that's very stressful.
I would be livid, first off, freaking out. I mean, thankfully, Botox goes away.
Yeah.
Like 3 to 4 months.
Yeah.
But
you'll have to live with it for 3 to 4 months. So
like as an injector, how it like what?
Yeah.
It just doesn't make sense.
Yeah.
I think the most botched work I've seen was we obviously do like a lot of scar revision and stuff.
Mm-hmm.
So this one girl came in for a consultation and she had recently got lipo 360 in Colombia.
Oh.
This is your sign to not go overseas for surgery.
Oof.
It was like $1,500.
Wow.
First red flag. Actually, no, that's the second red flag. Colombia's the first red flag, I think. Anyways, I'm not even kidding you. Like, normally when you get surgery, you obviously have a scar, and sometimes depending on like how you heal, it can be keloided, which we can fix. When I tell you this scar looked like Pac-Man, like zigzags, it was so bad. Like I've never seen a scar like that. It almost looked like the surgeon was using like those like crazy scissors with like different patterns.
That's so bad.
Like her belly button, first off, was like way higher than a normal belly button. It was like re-put in, and then her tummy tuck scar literally was like this.
Wow. It actually
like,
reminds me that
it's not funny, but like I've just never seen anything like that. And like I'm very upfront. Like, yes, we can help with the keloiding situation, but I obviously can't help straighten your scar out. Like that's the surgeon's doing.
Yeah. No, it reminds me that in one of my emergency room rotations, we had a patient coming in with severely infected liposuction scar, tummy tuck scar, severely infected. She was at a point where she was delusional. Like she couldn't even say her first and last name.
Isn't that like sepsis?
She was having sepsis, and she also had the surgery in South America. The one thing with having surgeries, some of them can be good. I mean, not all of them are botched, but you would not have your surgeon to follow up with you if something like that happened.
No,
you would not have him right there with you to follow you, to give you antibiotics.
But also the downtime, like when you're doing an intense surgery like that, whether it's like a BBL or lipo or things like that out of the country, recovery is obviously more than a week, like sometimes 6 to 8 weeks to do anything. So then when you're traveling, like, and the pressure, and then you're, like you said, your doctor and surgeon aren't even there, like what am I gonna do, Zoom call him? Like, I'm sepsis, I could die in 24 hours. Like what?
So I mean, we had to treat her urgently because she was not doing well, but I don't know why she waited for so long. I think first she didn't want to deal with the emergency room bills, right?
Yeah.
And then I think she was also embarrassed that she went and paid so little for the surgery, and this is what's happening to her. I think what happened to a lot of patients that are doing that.
No, I mean, your money, your choice, but when it comes to those type of things, I would definitely not go out of the country.
Yeah.
With my common sense.
It's scary. It is.
But yeah. Okay. What is the craziest request you've had a patient ask you?
Craziest request.
Or that someone's come in for and they're like, I want this, and you're like, you absolutely don't need
I wouldn't say a craziest request, but I feel like because we just had a patient that did the same thing. It's one thing that keeps on coming back. It's in a way crazy request, but in a way it's something that I feel like a lot of people are thinking when coming to see us, specifically people in their maybe 50s and 60s, that they have a lot of droopiness to their skin.
Yeah.
And they come to us and
they're like, I want
this. I want this.
Exactly.
And I'm like,
I want to look like this.
I wish I could have do that to you. I cannot do that to you. The only thing you can do for that is unfortunately surgery.
Yeah.
But I feel like a lot of people think that with Botox and fillers, we can just completely lift our skin up.
Yeah, no.
And we can't. But this is something that I keep on hearing every single time. And I have to manage expectations with the patient and explain to them, yes, we can do Botox. We can maybe relax those lines that you have in your forehead or in your glabella. But we cannot completely lift your skin up.
No, when people come in like that, you can't just be like, you need surgery,
Right.
To get your end goal. Morpheus and Sculptra can help because what those are doing are actually strengthening their skin. So it actually helps them get a better effect when they do a facelift.
It helps by a lot, but
But that is filters on Instagram or these celebrities that get everything done and aren't going to tell you. So we're not magicians here, and that's just not really possible to do unless you're doing some crazy, which we're gonna get into like later on in the episode.
We can improve it. We can definitely improve it by a lot.
The best things that I see on Instagram is all of these before and afters. Some places here in Miami, and they do the PDO threads, and their fox eye is like so fox eye that the people literally like can't even open their eyes.
Yeah.
And that's like what people come in and they're like, can you do this? I'm like, do you actually want that? Like,
the thing with PDO threads, it can benefit some patients.
No, but there's so many risks.
And the thing is, it's not long lasting. It's very, very invasive procedure. So for that type of procedure,
high, prone to infection. Like, you literally have a thread in your face.
Yeah, and it does have a lot of side effects. So for me, if the patient is a very good candidate for that, I would, but normally I would not recommend PDO threads.
Yeah, I'm just saying my opinion. I wouldn't do it. Now, getting into when you were talking about like the brow lift, in order to be an aesthetic injector, like there's not necessarily a school. Like obviously you have to be an NP or a PA, but a lot of people just do like a weekend certification. Explain the difference from you being a master aesthetic injector and obviously dealing with full face balancing and correction, symmetry, to someone who is just like trying to sell you Botox and filler and can't really describe things.
Being a master injector is a combination of things. It's not just one thing. It's not just training. It's not just years of experience. It's a combination of a lot of factors. So I feel like to be a master injector, you just need time. First, you need time. You need to have those years of experience, because we can all take those courses and come and try to do what they taught us. But you have to do a lot of trial and error to actually understand things or how they work, what works for certain people, what doesn't. So it does take to have some years under your belt. And
I think the best injectors are, you have to be an artist as well. Like you have to be able to determine the symmetry or like little things and tweak things on the face. For instance, if someone comes in, how are you going to determine what they need without just giving them lip filler when they might not even need lip filler, and it's like their temples needed to be filled or like chin shadowing. I think that's also a good thing. And you see obviously there's so many injectors everywhere, but not every person knows how to do that.
No, I was telling someone the other day that you can think of it as like painters. Everybody can take a painter course or whatever it will be, but not everybody can be a good painter.
Yeah,
it's
an art. Mean, I suck at painting. I like painting, but there's no way, like, getting into the little contrast and the depths, no thank you. But no, I get it. It's the same thing.
It's artistry. Like when I'm looking at the patient, I'm almost looking like at a canvas, blank canvas. What can I fix? How can I fix it? How can I improve symmetry? It's a lot. So a lot of people can be injectors, but an injector also have to have an eye for it, for the artistry, for the perfectionism.
And what's also crazy to me is how, I mean, you hear it all the time too, like, oh, my injector freezes my face with 10 units. Like, first off, as an injector, why are you devaluing yourself? Like, why are you telling patients, oh, I'm putting 10 units on you if you're doing like 20, 30, 40? I just don't get why they would even say that or do that.
No, 10 units is definitely not possible to freeze your face.
It's almost like people pleasing. Like they just say yes to whatever the patient thinks or says.
It's kind of like to learn them in, and some people will do everything and anything to learn people in, and it's not okay because you also have to have ethics in your job. Yeah,
like you don't want to do something and then it looks awful, and they're walking around being like, oh, I went here for that.
Yeah, I care about how my patients leave the spa, the clinic, because my patients are my business card. You know, people go out with, say, their lips or their fillers or whatever it is, and people look at them and say, oh my God, who did your lips? Oh my God, who did your filler? And this is my business card. So for me, it's also very important how patients leave, not only of how they want to look.
Also, any procedure that we do here, it's all about the experience too. So like we're not gonna just have a patient come in and be like, bye, see you, like never, like following up with them, making sure they're comfortable throughout the treatments, what their lifestyle is, like any little thing will factor in. And when you ask those tedious questions, they can be time consuming and annoying, but that's how you're, one, going to have retention and the client come back, and then two, you're going to get the best results. Because like, let's say someone's coming in for laser hair removal and I don't ask them, one, if they're on antibiotics, which if they are, I could literally burn them. Or two, if they're like taking biotin and like still having full hair growth. Like little things like that matter, and that's why people come back.
Let's talk about trends. And
we love the trends.
And which one we actually think are a bit bizarre and not fitting. I can start.
Okay.
There's one trend that I keep on seeing. Actually, a lot of my friends are asking me about it. Is the facial taping.
I think I have seen that on TikTok.
I've seen it. Thankfully, I actually see it everywhere.
No more water. Thankfully, I feel like I'm on the good side of TikTok for trends, which is like the wellness side. Like people are becoming more aware of their health. When it comes to aesthetics,
which is good.
Absolutely not.
But because I'm in the Botox industry and everything, and this is what I follow and see, I get to see a lot of this taping and silicone patches that people do.
Oh my gosh, the DIY Botox.
Yes.
Your wrinkles are going to be gone if you put this gel patch on your forehead.
I mean, I wish that would be the case, but unfortunately it's not.
If that actually worked, Botox would never be out.
Yeah. It can improve, while we're sleeping, we're moving a lot and our face is, against the pillow, and then we have a little bit of wrinkles. So maybe it can prevent from that happening, but unless you weren't
I can see it helping, I guess, for prevention. Right. But if you already have static lines, it's not going to do anything.
Also, I mean, during the day we move our faces, we make expressions, so we can completely prevent
unless you're literally AI and have no emotion and you just
leave those tapes for 24 hours. I mean, maybe then, but those tapes unfortunately don't work. If that makes you feel a bit more comfortable while you're sleeping, sure, go ahead, but that will not replace
if
Botox.
It makes you think your wrinkles are going to be gone, do it.
Yeah. But no, it will not replace Botox.
No, not at all.
No.
A trend that I was seeing is the tattooing freckles on the face.
Yeah, I've seen that. I've seen that many times.
I get it. Like, freckles can be cute, but freckles, like, if you naturally have freckles or it's genetics, like, yeah, keep them. But also a lot of times freckles is like sun damage or age spots. Like, why are we tattooing freckles on the face? Like, why do you want sun damage on your face? And it's a tattoo at the end of the day. Like, it's still ink in your face, and I don't know. I just like think
it's permanent.
It's just not a cute look.
So tattoo can change pigmentation, so it can become
like
bluish.
It fade over time. That's why I haven't done microblading. Like, I've been wanting microblading so bad, but obviously it's a tattoo.
Yeah.
And when you're in the sun, especially here in South Florida, they fade. Like, even my tattoos are like faded and there's a bluish tint. So like, why would you even want that? The sunscreen contouring. So people will only put sunscreen on like their cheekbone and like down here and like not on their forehead. So then like their cheeks will be more contoured. Just put contouring on. Like, it's not that hard. Just sunscreen your whole face.
Sunscreen is very important to spread throughout, specifically also in the neck and chest. I feel like this is an
area. And also when you have a good sunscreen, it can leave a harsh line. Like, if you are not putting it on the full area and you're out in the sun and not reapplying, like, you will literally have a full-on line.
Wear your sunscreen all over. Spread it throughout. Don't miss your neck and chest.
Yeah, neck, chest, arms, well, specifically hands. If you just sunscreen your face, those are going to show your age. So we want to look young and hot forever.
All throughout.
Everyone deserves to be a MILF. So sunscreen everywhere. Wait, what's your thought on the hyaluronic pen?
Oh, oof. I can tell you that I have not seen one patient that came back to me after having a hyaluronic pen that looked normal, decent, or had natural looking lips.
It's just, to me, like, I guess people aren't educated, so when they see like bigger lips right away, like, I can literally put jalapenos on my lips and they'll look big right away.
Yes, you can.
There's no research or like education behind it, and also it's literally air. Like, what are you doing? If anything, you're causing scar tissue.
It's not accurate. To do lips, you have to have a certain level of precision. You know, you do small increments until you see the results that you want.
Yeah.
But with hyaluronic pen, you don't have that. You just inject the hyaluronic acid, and there you go. You have full lips without no precision or no aesthetic final result. So I would definitely not recommend it to anybody. I know it can be very appealing because of the price. The price is very
if it's too good to be true, it probably is.
Yeah.
That's all I'm saying.
I corrected too many
But
lips.
To each their own. I mean, we definitely don't do that here.
Yeah.
I don't even know how it's not even FDA approved, first off. People don't know that.
Yeah.
So, in honor of Love Island, who is the one cast member that you would bring in to fix their face?
Okay. Not to shade anybody, but there's this one cast member, Sierra, which I think I would bring her in and most likely dissolve her lips, because I think she also shows some signs of migration in her upper lip, specifically when you see her in a side profile. It protrudes outwards a little.
No hate. We've all been there.
Yeah, so I would probably dissolve her filler, give it a little bit of time, and then refill. There's so many new techniques right now to prevent that protruding duck lip look. There is the Russian technique that I'm sure everybody heard about because it's all over, that mainly focus on giving you flat lip look, specifically when you're looking from the profile. So that will prevent that ducky look more.
And it takes, one, obviously a good injector, but two, they had to like come to a realization. Like, I thought for the longest times my lips were totally fine. I was like, what are you talking about?
Yeah.
I had lip filler blindness. Yeah. And then I was like, oh my god, this is awful.
Yeah.
I look like a stripper. I would bring in Huda.
Okay, and do what?
I would have you dissolve her lips too. Sorry, girl. And her facial features are like actually so pretty. She has like good symmetry.
Mm-hmm.
But I definitely think that she would benefit from PRP underneath her eyes because she always, like, I don't know if she's just like crying and crashing out all the time. But PRP will help with the darkness underneath the eyes.
Yeah.
To make her look like more alive and fresh. And then honestly, like all the girls could benefit from laser hair removal, like being in thongs all the time. Like no one wants to see hairy bushes or wants to shave. But yeah, that's probably like the two on the cast.
I don't think people understand how life-changing laser treatments are.
Yeah. Guys, I haven't shaved my Brazilian in 8 months.
Yeah. Well, that's
I'm not lying.
Specifically for women, it's we have to maintain these things all the time, and say if you're starting to date someone and you always want to be smooth.
Yeah, but not even that. Like we live in South Florida. Like we're always in a bathing suit. Yeah. Unless you want to be hairy, by all means you do you, but I don't want to be hairy.